Hello, my name is John Lai. I'm the CEO of PetVivo Holdings. My vision is to restore mobility and the quality of life of our beloved pets, horses, and one-day people. I believe with Spryng, we can achieve this vision. I have always focused on companies that had a unique niche technology where I felt it was innovative, where the industry would eventually figure it out. The scientists, everybody was sure that the product was better and that we would fulfill a need that's out there. Spryng and PetVivo had that opportunity. The science was originally developed at the Mayo Clinic in Rochester, Minnesota.
One of our founders, one of the inventors of technology, David Masters, came out of Robert Langer's lab at MIT.
It was initially funded by NIH, National Institute of Health, and the Department of Defense, so there was DARPA money involved.
You know, the company had some NIH, National Institute of Health funding, but the roots of the company was based on even some human stuff.
So everything was done towards the human market, so there's been a lot of experimental approaches.
So David's concept was, he wanted to find a biomaterial to deliver drugs that was extremely biocompatible so that the body would be very willing to accept it.
Think about taking the building blocks of tissue, human tissue, dog tissue, horse tissue. What we do is we take the building blocks, which is proteins and carbohydrates.
And his thought process was, well, maybe using proteins and using carbohydrates that are already part of our tissues would be a fabulous way to do that.
And we figured out a way to get them to come together. They self-assemble into a material which really mimics mammalian tissue.
The material would be very well accepted by the body, and that's kind of where the technology started.
So how I got involved was their patent counsel as well as their attorney, probably the second largest law firm in Minnesota. One of the partners reached out to me and said, "Hey, John, would you have an interest in taking a look at this and commercializing some of this technology?"
What they originally wanted to do was do a dermal filler. So what we did was a human clinical to try to fill that in, and it did very well. But at that time markets were not very good in putting another dermal filler in the market.
What we've done is designed a system that will allow us to quickly and efficiently transition our process for the humans. And what we gain from that is the pet owners in our current veterinary product are getting an above average or above industry standard for the veterinary space product.
So I once made a comment, PETA should like us because we injected the people before we actually sold the product to take care of your pet.
Our people ended up looking at the product and said, you know what, this product is very similar to mammalian tissue, and it has kind of a mechanical characteristic which is similar to cartilage. So maybe we should try to put it in the joint.
Because it clearly had a lot of advantages over current therapy. I looked at it and I go, well, the problem here is the data's too good. And he looked at me funny and I said, because it's beyond what doctors would believe. You're gonna have a lot of education on the human side of the market. So I would recommend going to the small animal side. They didn't have any interest at the time. And then they came back to me probably 90, 100 days later and said, okay, what is it gonna take?
PetVivo is a biomedical device company that focuses on treatments for animals, especially horses and dogs. And with me is John Lai, the CEO, with an update on what you've been working on lately. It looks like you've been very busy. You've got 17 products in the pipeline.
We developed a protein particle matrix that mimics cartilage and tissue. So we're a true biomaterials company that has multiple applications in the companion animal space as well as the human space. And our initial product is called Spryng with OsteoCushion Technology. It's a very innovative, effective tool in the management of osteoarthritis, lameness, and rehab for veterinary doctors. We have probably 21, 22 patents around this technology, but beyond the patents are our trade secrets. So the uniqueness of our product is that it self-aggregates and then creates these particles.
Spryng is a novel hydrogel-based material made of collagen and elastin, proteins that are naturally derived, that form a extracellular matrix that can be implanted into the joint space for high biocompatibility and low immunogenicity, meaning that it's very acceptable by the body and exhibits a low immune reaction.
Well, the original material that we made out of collagen, heparin, and elastin is used in a number of applications. It's been used to coat stents and to coat catheters, for example, to resist blood clotting on those things. It has a natural anti-thrombogenic property. Because this product requires what is called an intra-articular injection into the joints, so the particles go into the synovium. The synovium starts an effect where the particles form a scaffold. It recapitulates that function of the axillary matrix in tissues. So it's not seen, we think, as a foreign material, but as something familiar, but that material now can be used in a remodeling process in the tissue.
And when you don't have that friction, you don't have the inflammatory stuff. So the joint continues to work painlessly for a longer period of time.
But the material also then migrates into the synovium, and the synovium is a very important tissue in joints. It really kind of regulates the biomechanics, and people think of the joint as an organ actually because there's multiple tissues in the joint, and the synovium is really important for maintaining the health of that whole organ that we think of the joint as. So when Spryng is incorporated into the synovium, those cells in the synovium are responding to it and are remodeling.
So that scaffolding process is quite unique in the sense that it improves the joint health. So as time goes, you're actually getting a better scaffold function to provide better cushion between the joints. And the particles in itself will go into the areas where cartilage used to be and mimic the cartilage that was there.
It's very slick, and to me, that's a game changer. I've been a practicing veterinarian for 46 years. Going through the years and using it on cases that I've worked up and had a pretty darn good idea of the pathology that was in this. My personal theory is the way that it works, it binds to the cartilage and to the synovial membrane to help the movement of the joint.
I used to own horses. I grew up in Montana. My babies had a lot of joint issues. When I realized what they had, horses, just like humans, get osteoarthritis.
So to give you raw numbers, there's 8 million horses in the United States, about 83 million dogs in the United States, and about 55 million cats.
2/3 of our revenue really was the equine, which are the horses. We've been helping a lot of those retired racehorses to get back to the spunk and kind of what they had before to help them out with their joints.
Twice second, can she win it? 3 count is the leader, Kelly's on her in
PetVivo came to me. When I was in the large equine practice, we had discussions about the product, and they asked me if I'd be willing to test it on. I've used that product for probably 12 years, maybe longer. Well, one of my favorite success stories is a warm blood mare, been actually lame for a couple of years, been worked on by an outstanding practitioner. They had been getting routine injections, and this is even with one of the new orthobiologics, and everything's been working pretty well, but over time, less and less and less effect. So I was asked to take a look at the horse, and I looked at the horse, and through my workup, yes, it was a stifle. The horse's stifle, which is similar to the human knee. It was a damaged meniscus, some chronic inflammation, and discussing with the client, I'm like, I don't work miracles. So what you have is a very chronic joint here. But I said, I do have a product here that can help bind to some of this, perhaps, that's the hope, and smooth out the joint. So during my workup, this horse was what we would call an easy grade 3 out of 5 lame, which means if you made the horse move, you knew there was something wrong on that leg. And so we injected it. I came back in 2 weeks because I wanted to re-inspect this horse to see how it was doing. They pulled the horse out, and I was like going, this is a good joke. Can you get the real horse? And they're like, this is a real horse. Going, no, this horse is sound. And there's no way this horse could be sound. And yet, it was. And put the horse through some pretty good stress tests, and it stayed sound. The horse is a very comfortable broodmare at this stage. Yeah, I'd recommend this in a heartbeat.
So osteoarthritis is basically the wearing away of cartilage. And it's a condition that doesn't improve with time, it only gets worse with time. So ours is beyond just osteoarthritis. There are other conditions that are causing lameness. And then another segment is rehab. So if there's an injury, damage, our particles seem to reduce the time that's needed to recover and come out of rehab. So the classic example of that is when there's a TPL surgery, which is one of the most common surgeries for dog. It's about 100, 120 days of rehab. With our particles, it's cut, it looks like at least in half, but also the contralateral, which is the bilateral joint, tends to fail within the first 12 months after the initial surgery because there's so much stress added to it. It's probably a failure rate close to 80%. The vets are finding out if they inject that with Spryng, the odds of that failing is greatly reduced. So you're saving a second surgery that may not be required if you just didn't do the Spryng injections.
You think about it, there's 4 legs and there's 3 joints in each leg, plus a hip. So there's a lot of different points. And one syringe can actually do multiple joints. It's not just one joint, which is really nice. So it really makes it affordable.
Come here, Jasper. This way, buddy.
That's pretty meaningful in terms of time and quality of life. It's just not a product you're just going in and it has a minor improvement. It actually very tangible in the first 10 days. And because of the scaffolding effect, actually over the next 90 days, you may even see more improvement, which is quite unusual because the other competitor's product is very short-term oriented.
We've seen from our preclinical rodent studies that the time of injection and the number of injections plays a role in the therapeutic efficacy of the platform, which has been great to see because that reflects what we're seeing in the field from our vets.
I've seen clinically some outstanding effects and bought a lot of time for horses using this product and keeping them comfortable for the rest of their lives, competitive during their competitive life.
I think one of the things that make Spryng exciting is that it has a ton of modularity and plasticity to it. It can be used as a microparticle injection, but it can also be a gap filler as a paste, or it can be slid between 2 sites of bones in a defect as a sheet or as a puck.
So for the last 2.5, 3 years, we've been focused on creating the studies to give the efficacy behind the product because the product is quite innovative and it's the only product out there really focused on the root cause of the problem, that is bone-on-bone contact wearing away cartilage.
The quality testing that we perform on Spryng is, I would say, more significant than the industry standard for the veterinary market. We use multiple testing sites. Sterility testing is taken after every product intermediate step.
We had a press release that talked about all the positive results. It's the veterinarians that are calling us like, this stuff works.
So I met John 2 years ago. I had an interview. He really explained with a really amazing team that was on the medical side, really backing him up on really how the company runs and how the product works. So when I met him, I was quite impressed. He's quite charismatic, very, very knowledgeable. And I really wanted to test the product. So I waited a year before I started using it. I used it a couple of times. And I really didn't buy into it. And then I've been consulting with a bunch of physical therapists that I work with and other surgeons that was like, this product really is making a difference in the recovery time and the quality of the recovery. So when I say, you know what, I'm gonna start ordering products and I'm gonna start using it.
Everyone else, probably for the last 15, 20 years, has been focused on attacking the symptoms of pain and inflammation, creating a pill that has less side effects. Because every pharmaceutical will have a side effect in the body. Our product is biocompatible, so we don't see a reaction, which is a major advantage.
And you don't have to use anti-inflammatories. You don't have to use corticosteroids.
And it's the general trend right now in medicine, not only in animals, but as well as humans. Everybody wants to get away from the pharmaceutical drugs, because if you think about what is the gold standard treatment for osteoarthritis, is NSAIDs, an anti-inflammatory.
All those synthetic products that clearly are putting a Band-Aid.
Well, when you do prolonged anti-inflammatory, what happens is you create all kinds of side effect action like GI tract bleeding, liver and kidney problems. And the one that I always bring up that other people don't really think about is if you're masking the pain, your dog's going to run and jump in situations that normally would not, and actually cause the degrading of the cartilage even faster.
And they're helping by fixing the symptoms, but they're not restructuring and creating that barrier protection. So the Spryng injection is very, very easy. We do many surgeries a day, many orthopedic procedures a day, and like I said earlier, every single joint surgery that we do is gonna get the Spryng injection.
My assistant and I used to joke that it takes longer to prepare the joint for the injection than it does to do the injection. You know, my part of the procedure should take 30 seconds. It's extended their quality of life. That was one example I gave you. It's taken athletic horses that I can improve them to 90%, and this product allows me to improve them to back to 100%, back to that what would be considered normal. So I can get back to where they need to be to compete at the highest levels. Racing, jumping, dressage, cutting, reining, it makes your joints feel better. And if you're over 50, you know what that feels like.
We're very excited that Spryng becomes a first use type product. What excites me and the rest of the team at PetVivo is that we're doing something to really help quality of life of animals and people, because people are able to enjoy their pets longer.
There's a lot of investors that may be short term. That kind of has nothing to do with really us. But the investor that sees where they have a companion animal and they've had improvement, they're in for the long haul, and they want to see where it's going to go. People spend money on their dogs, but they love their dogs. This technology, I'm really glad I'm at a company that has that helped change and improve the quality of life.
You know, owners thought that maybe there was no hope and used us as a last resort and saw these amazing results. And we're so early on this journey, and there's so many things we think we're going to be able to do with our biomaterials. It's just really exciting to think about where we're going to be in the next 5 to 10 years.
We've got a wonderful set of scientists, and so they're constantly trying to make Spryng better. They're constantly trying to better understand what Spryng does when it's put in the body. And so we're learning more and more every day, to where the product over a period of time will likely get dialed into what are the applications that we're using it for.
Currently, Spryng is being used in horses, dogs, and cats, but we're very excited to translate that into humans in the nearby future.
And so our team is experimenting daily with what are some of these permutations that we can end up creating new products, which will not only benefit animals, but hopefully will benefit us.
We never know what the future will hold to go into the human side.
All the employees feel good because we're helping animals improve their quality of life and people. So I think that's the biggest driver, because if you look at our management team, their experience, they can be with a lot bigger companies. And many of them came from a lot bigger company, but they believed in the product we're doing. They believe that we're helping people and animals, and that's why they're here, I think.